Unexpected costs, access challenges, and long wait times. The barriers to seeing a doctor can stand in the way of receiving health care. A new poll finds that public satisfaction with the U.S. healthcare system is remarkably low. Many are now looking for ways to make improvements. This is where direct primary care comes in. And to explain more about what this is, we're joined by Dr. John Rodriguez. Thank you so much for taking the time to talk with us today.
Sure. Thank you for having me.
We wanted to start off, what did we see from the recent poll about satisfaction with our health care?
Yeah, I mean, again, to me, no surprise. We've been seeing this decline for quite a number of years now. It's just a hurry up healthcare system we're in now. Everyone's in a hurry. Doctors are in a hurry to see as many patients as they can, trying to fight insurance companies because of the poor reimbursement. So that clash is, we're seeing the inevitable result is just poor patient satisfaction. And so when you're only allowed 7 minutes with your physician to maybe go over 2 or 3 items, can be pretty frustrating in terms of the care received.
What are some concerns that we're seeing from people?
Yeah, the concern that, quote unquote, the doctor didn't listen to me, right? So patients walk out of the exam room just feeling like their questions weren't answered, their care wasn't appropriate. And so they're left kind of in the dark in some sense, and good or bad, the patient is not happy. And then they may seek care somewhere else or find another physician or clinic to what they think is receiving better care. But unfortunately, it can be the same song and dance from clinic to clinic.
What are some steps that you are hoping can be taken to improve circumstances?
Yeah, so with Healthcare to You, we advocate more of a direct relationship with your provider. So really, the sad thing is, at the end of the day, it's about trying to make a living, and clinics are trying to make a living. And when you're not paid enough by insurance companies and third-party payers, the quality of care suffers. And so we're trying to bring more quality back in healthcare and make it more direct, a direct primary care model, which is advocating for that relationship, financial relationship with a clinic or a physician that really puts the onus on the physician to provide that better care without having to worry about filing claim after claim after claim.
How can this make a difference for patients?
Yeah, so for patients, it's a much better experience. The patient is spent and allowed more time with the physician, with their primary care provider, instead of 7 minutes. Now it can go really as long as 15 to 30 minutes if need be to listen to the complaints of the patient. And the physician is obliged at that point, because he's now in a better financial position to be able to take care of that patient and provide the care they need, whether it's further testing, whether it's less testing, and saving the system money because the physician is able to listen. And I think that's the key in all this, is that the quality of the patient care is heightened, as well as the value of the care given is improved on, and that there's not a lot of wasted testing, a lot of wasted referrals, which adds to the cost of healthcare in general.
Are there any steps that patients can take to improve their experience?
Sure, absolutely. I think number one is being patient with your current provider. I mean, understanding that there's a lot of burnout amongst physicians. They're just very unhappy and they feel like they're trapped. And so a lot of physicians just are not capable of giving the care they would like to give. And that's, I think, the frustrating thing in all this. So what patients can do is, number one, just be patient with their provider. Number two, understand that they're going through some struggles. But at the end of the day, really, what can the patient do if they're looking for better care for themselves is to seek out a practice that probably has a DPC sort of a model. In other words, a cash direct model where the patient would pay either a small monthly fee to be in that practice as a membership, and thus allowing that provider to give the care that patient deserves. So.
Dr. Rodriguez, thank you so much for taking the time to come on the show and walk us through this.
Sure.